Good afternoon, ladies and gentlemen. I'm going to talk to you regarding the effect of drugs that produce dry eyes. Whenever we talk about dry eyes, normally we keep ourselves around the eye and the nexa. There is something more beyond that because the secretion of the tear goes through a very, very complex process. There are so many organs involved in this. Whenever a patient comes to OPD who is on multiple drugs and medicines, when he complains of gritty eyes, itching, when there is swollen eyelid margins, and then the patient, when he comes, probably he is suffering from that of the dry eye because of the drugs. Why should drugs affect the tear secretion? Because the tear secretion comes through the central nervous system. The impulses are from central nervous system through the superior salivary nucleus, and then there is a nucleus solitarius which is from an autonomic system. So autonomic system, the central nervous system, as well as there is a reflex arc which passes through the eye and the pterygopalatine ganglion. So all these three factors come along when when it comes to the secretion of proper tear film, and therefore when we classify these drugs which produce drug toxicity, it could be topical drops and eye ointments, systemic drugs and oral medications. The drugs which are applied in the eyes topically, maximally which produce the problem are the beta blockers. So why we have problems with these drugs? Because normally the patients are on these drugs for almost rest of their lifetime. So prolonged use of all these drugs create problems. Antibiotics and other drugs like atropine, anesthetic agent. So these drugs, atropine and other, they act by the reflex mode of action. But the most important amongst the list is the tear substitutes. These are the drugs which are used for the treatment of dry eye, and they all contain preservatives, and the patient use it for very, very long time in very high frequency. The preservatives like evaporative, benzalkonium chloride, sodium perborate and others, they have deleterious effect on the eye. This is a study from the Vision Center, and various drugs which are used in the treatment of dry eye are checked for their capacity to desiccate the corneal epithelium. So the corneal epithelial desiccation quotient was tested for all these drugs by putting the drops for 30 minutes in the eye. And the drugs, some of them have benzalkonium chloride, while the others, they have the non-preserved, the unit doses. So we will take two examples. The hypotears, they are with the back preservative, and the tears endura is with the unit dose. Now what happens that the drugs, when they are put for 30 seconds, the ones which have back as a preservative, within 30 minutes they have produced quite a good amount of desiccation, and then the ones like tears endura, they have very little desiccation of the epithelium. So the preservatives do matter in the treatment of dry eye. And then the evaporative preservatives, they also have same amount of effect when they are used for a long time. So so-called evaporative preservatives, once they are put, the drop goes inside the eye. The time between it evaporates, it gives you the deleterious effect on the corneal and the conjunctival epithelium. So one may not be very assured that since the preservatives are evaporative, the patient is not going to get any problem. So this is the desiccation index. The first one is the buffer solution where there is no preservative, and there is only one which has minimum amount of, no amount of desiccation, and the other one is the unit dose preservative, tears endura. Otherwise, all the drugs with whatever type of preservatives they have, they had a deleterious effect on the corneal epithelium and conjunctival epithelium with severe amount of desiccation quotient of the corneal epithelium. Thus, when we talk about the drugs which produce effects, we should consider the tear secretion from the central nervous system also. So the systemic drugs and the oral medications, all of them, they have a severe effect on the eye. The drugs which are used as antihypertensive for the angina pectoris and other conditions like myocardial infarctions, all of them have a tendency to decrease the tear secretion, they decrease the lipase, lysozyme formation and the immunoglobulins also, and ultimately the overall secretion of the tears is decreased, leading to dry eye. Dermatological drugs, the retinoids, 1,3-cis retinolic acid, which is used in the treatment of acne. It produces meibomian gland disease. the antipsychotic drugs like phenothiazine and chlorpromazine, both of them have a tendency to produce transient dryness of the eye, and once the drug is stopped, within 2 to 3 weeks the patient gets back to the normal tear secretion. Antihistaminics, these are the drugs which are maximally used in the treatment of common colds and allergy. The drugs like Benadryl, chlorpromazine, and then other anticholinergic drugs which are used in treatment of the allergy conditions, and the combination of the drugs which are used for common cold like decongestion, they produce decrease in the mucus and the aqueous solution, and the antibiotics along with them which are used for the treatment of cold and the pain relievers like ibuprofen, altogether they reduce the tear secretion. All gastrointestinal drugs like pantoprazole, omeprazole, ranitidine, cimetidine, all of these, they proton pump inhibitor drugs, they decrease the tear secretion. All antidepressant drugs, they also have an effect of transient decrease. Chemotherapeutic agents, they have the effect of decrease in tear secretion as far as it goes to the 60% of these patients suffer from dry eye. And then these effects of the dryness occur through the superior salivary nucleus. So it is a central lesion or central effect that's causing dry eye. And therefore, whatever we do on the topical, as a topical treatment of dry eye or anything else in the treatment of inflammation, probably the patient, they don't recover because of this very reason, that the effect is at some other place. Then the women who are on the hormone replacement therapy, they have a tendency to develop dry eye. Estrogen dependent women, they have 69% dry eye, and progesterone 29%. So these hormones are used in the treatment of dry eye because of the hormone deficiency, and they themselves produce dryness of the eye. The effect of these hormone dependent dry eye is at this level. The nucleus solitarius, which gives the fibers through chorda tympani, then it goes with the greater superficial petrosal with first relay, and this is the site where the autonomic nervous fibers come. Probably this is the effect where the hormones and the stress factor is effective, and that leads to formation of dry eye. So how to diagnose the history? This is very important when the patient is on drugs for a very long time, and in what particular drug he is using. Say for antihypertensive, also generally patients who are on beta blockers, they develop more dry eyes. Therefore you have to inquire about the particular brand as well as the type of drug he is using. Slit lamp examination, as you know, it's very important. Then tear secretion test of different types, we just heard about it. Then conjunctival staining with rose bengal, lysamine green and fluorescein. With lysamine green gives you the idea regarding the mucus secretion, rose bengal tells you desiccation, and fluorescein gives you the idea regarding the desquamation. And then impression cytology. So when you find that the tear meniscus height is less than 0.2 millimeter, you should be careful. Like empty lacus lacrimalis, here there is no tear. The meibomian glands diseased, the marginal glands, they are diseased, inflamed, and you find froth and the openings, then filaments. And then when you stain with the lysamine green, you will find deficiency of the areas, and then there are mucus strands on the eye. So all this can tell you together that there is something wrong. And when you do impression cytology, in the initial stage you find breaks in the proper spreading of the tear, the conjunctival film with the desquamated cells visible. As it goes further, you find pycnotic and double nuclei, and then the cells break with large breaks inside the area, and ultimately you find there are very few cells, there is dryness, and then you find clumps of the mucous membrane along with the epithelial cells. So altogether this gives you the idea regarding the severity of the eye. Then what to do for these patients? How do you help them? First, consult with their health providers, physician, cardiologist, neurologist, because it's not we that we can stop or change the treatment. So they have to be taken in consideration. Why I say health providers? Because along with them, the physiotherapists also, or there are other people who are helping, like massagers and all, those who are giving infrared rays, etc., or hot fomentation, like that. So all health providers should be, the history should be asked properly, and then they should be consulted to change over the technique or the drugs. Second, the patient education. The patient must be made aware. He should be made accountable also for the treatment, whatever he is taking. He should also made to know that he must understand that with which drug that he is developing these symptoms. And then the circumstantial factors, which are very important, like hygiene, frequent washing. People are in habit of frequent cleaning of their eyes or rubbing of their eyes with excessive amount of use of air conditioning without humidifier. So all these things, simple things like keeping the car glass of the driver's side closed can help many of these patients. So all these things should be kept in mind. And then where do we come? Treatment, we change the drugs as far as possible for these patients. For us, what to do, how to select drugs? Best way is to select drugs with minimum preservative or with unit doses which are non-preserved. Now that we have many options with us, so it's always to give unit doses where the preservatives are not there for the patients who are going to use it for a very long time. Avoid the ones with benzalkonium chloride as preservative for a long-term use. Polytherapy, we are in habit of prescribing many drugs. For each symptom, there is 1 or 2 drugs. So that should be stopped. And very high frequency of drugs, 1 hourly drugs of 45 drops, etc. should be withheld. And then epitheliotoxic drugs like aminoglycosides, all antimetabolites, and very high frequency 45 drops should be kept in mind. Toxicology, all these things that tell you regarding this since 1993 that we have started understanding. So ultimately, to conclude, I would say that all these things lead to dry eye, but the most important is this: the treatment of dry eye leads to dry eye. So can we prevent it by proper attention? Thank you very much.